Why she cheated. Every woman cheats for her own reasons, and there is no one answer. Now, as we discussed earlier, you are not the reason she cheated. I'm going to go through some of the influences and factors in why she could have cheated, and something might apply to her in your situation. Now, these are not cause and effect, because there are other women who've had these same issues or same circumstances, and they did not cheat. These are influences or factors that are present, and if not dealt with, they can, cause a situation where infidelity becomes a choice for her. These are not in any specific order, and they just reflect my clinical experience of over 40 years working with real people who have cheated. And again, these aren't cause and effect or reasons. These are just factors. The first factor is abuse. Someone who has experienced emotional or physical abuse could still be acting and believing things about themselves that are not true. They can believe that they're worthless. But when they believe it with all their heart, they will be abandoned. They're not worthy to be loved. They'll push people away. And these beliefs lead to poor and sometimes self-destructive behaviors. Now, you did not cause these beliefs, and you cannot cure these beliefs. They will have to do that work for themselves. But the physical, emotional abuse is a factor for many people who cheat. The next one for women, it might sound a little left field, but abortions. And this might seem a little odd to you as a man, but I've worked with probably 1,000 women who I was the first that they told that they had one or multiple abortions. And these women are never the same again, especially if they have a faith background. Their self-rejection, their self-loathing, their guilt and their shame are huge factors in their lives. This lowers their self-esteem and their sense of worth tremendously. And they can medicate with addictions, which I'll get into shortly. And this would be a helpful question for you to ask her for sure, because often they don't tell their spouses unless they're directly asked. And I've had an incredible resource called Grace After Abortion. If she's had this issue, this can help her tremendously heal. Addictions. Now here I want to talk about addictions in general. In a bit, I will discuss sexual addiction specifically. Addiction can be a factor and an open influence for poor choices. Firstly, someone with an addiction is often medicating pain that is not dealt with, whatever that pain is. Secondly, they are spiritually, emotionally, and morally immature. They literally stop developing at the onset of their addiction, which is usually somewhere in adolescence, 12, 13, 14, 15 years old. So they look at the decision to cheat like a teenager would look at cheating on a boyfriend, not as a mature woman would look at their spouse and family. Now, thirdly, they get into an altered state, separating them from reality and responsibility when they use drugs, alcohol, Facebook, work, exercise, whatever they are addicted to, making them vulnerable to make poor choices when they're in these states of their addiction. Now, again, this is not an excuse, and not all people with addictions cheat, okay? This would just be an influence of the situation. Anorexia. Here I'm talking about intimacy anorexia, as we discussed earlier. There are intimacy anorexics who can do intimacy or sex, but intimacy and sex is a challenge. They can disconnect from you or be absent during your sexual encounter, but be intimate as far as a friendship and have a love for sex, but not a love for intimacy and sex. They might also have a porn issue as well, but we'll get into that pretty quickly. Almost most of the women I treated with sexual addiction were intimacy anorexics with their husbands. And if you go to intimacyanorexia.com, there's so many resources there on intimacy anorexia. You can get that. And if this doesn't heal, you will be in pain as long as you are married in this relationship, because intimacy anorexia has to be healed for you to stop feeling like a roommate. Intrigue addiction. Now, this is where your spouse gets off on having men check them out. They're constantly, dressing in a way or looking for, if a man's looking at them, making sure everyone knows that she's beautiful, validating that she's present, that she's beautiful. It's like, I'm attractive if someone else thinks so. The double looks, creating a schedule to be there at a certain time at a gym or a store or a coffee shop when Mr. So-and-so is there who likes to look at her. They have an intrigue harem. There's a couple guys at the office, a couple guys at the gym, a couple guys over here, a couple guys at church, that they get the little looks from. And it's almost like they have this little intrigue harem, really. Okay, and this can lead to flirting over time. It can lead to an affair over time. The intrigue addiction will have to be addressed. Otherwise, they will continue to lure others in the future into the same dance, and they'll end up getting the same result. Now, which again, that's really painful for you. Now, the DVD Intrigue Addiction is very helpful here. If she watches this and it fits, she can get counseling at the office with a female therapist that understands this particular addictive behavior to intrigue. Personality disorders. Now, this is tricky. And again, has nothing to do with you. You can't cause a personality disorder. Now, I'm only going to list these disorders and give their symptoms. And if this feels like it fits, I want you to Google the one that feels familiar to you, and then you can get help from there. However, don't use this towards them until they take a psychological test like an MMPI, which can actually assess whether they have a disorder. And if you call my office, there's someone there who can do a psychological test through Zoom, and you can get a real diagnosis before you go ahead and say, oh, I watched this tape and Dr. Weiss says you're this. Don't ever say Dr. Weiss said this. If you feel like any of this is a concern, take them and get a test and find out, okay? And what we really recommend is you both take them. Because sometimes there's an interaction dynamic between what's going on with her, what's going on with you. Even if there's not a complete disorder, there's just factors that are interacting that need to be understood. So that's the way we normally do it. So if you call and say, hey, we want to both take a test, they'll set you up and you can get it done, and you can get it very shortly, probably within a week, and know the results. And then you know if you're dealing with any of these disorders. But again, do not use these words against your spouse, because you're not a psychologist probably. You're not qualified to use these unless there's a test assessing it. It'd be like going up to someone and say, you have cancer. Okay, you don't know if they have cancer. They would have to take a medical test to know if they have cancer. Well, if it's a psychological disorder, you take a psychological test, and that way someone can say, yeah, a professional can say, this is what's going on with you. The first one is a borderline personality disorder, and these are the symptoms. They fear abandonment. People with bipolar disorder are often terrified of being abandoned or left alone. They have unstable relationships. Their girlfriends and friends are awesome and wonderful, and then they hate them, okay? They have unclear or shifting self-image. They might be really hyper-religious, but then really go over to another side of other things that don't match at all. So there's that. Impulsive are self-destructive behaviors. And usually it's impulsive in a couple areas: speeding, spending, food, sex, porn. Usually there's a couple of those kind of things. Self-harm or threatening self-harm. Extreme emotional swings. I mean, it's like you're here and then you're here, and you don't know how you got there. Chronic feelings of emptiness. Sometimes they feel very hopeless and no one's ever going to appreciate them or love them or value them or see them for how wonderful they are, and they get into this kind of deep place. Explosive anger, okay, over the top. I mean, you almost can feel like your life is being threatened. So that's borderline personality disorder. Again, if that has interest to you, do more research and do what you need to do. Histrionic personality disorder. These are symptoms. They're uncomfortable when they're not the center of attention. They are seductive or provocative in their behavior. They have very shallow or shifting emotions. The way it's kind of like they talk, but you don't really say anything. And it's like you feel like they've been in my life for a few years, but I don't know them. It's that kind of conversation. They use appearances to draw attention, okay? And you can usually see someone who's histrionic coming, especially in a woman form. They're impressionistic or very vague speech. It's like they might be passionate about something, but you can't figure out what it is. And that can be, another issue that you need to deal with. If it is, get a test. Now, I will say this. Histrionic is something that can be managed. We have a great book called Emotional Fitness, and a lot of people with the challenges with their emotions can get help with that, okay? Now, antisocial personality disorder, okay? This is another one that I've seen with female who cheat. And so it's not as common, but if it's there, you want to know. They repeatedly break the law, okay? And not just speeding, in other ways, taxes and situations, they try to get around things, okay? And it's usually a life pattern of these things. Repeatedly being deceitful. And maybe not just about the affairs, but money and relationships and their past. Being impulsive or incapable of planning ahead. Being irritable and aggressive, okay? Having reckless disregard for their safety or the safety of others, taking big risks that really seem unwise. Being consistently irresponsible, and they lack remorse.